Assalamu Alaikum viewers, I am Professor Dr. SMA Erfan, a colorectal surgeon. Today I'm here to talk about various diseases of the anus. As you know, I have been successfully treating and operating on patients with colorectal and anal diseases for a long time. For the last 10 years, I have focused on laser proctology. I am one of the surgeons who has performed the most laser surgeries for anal diseases in the world. Alhamdulillah, with your prayers, my success rate is among the highest globally. Today we will talk about fistulas and their types. In the previous episode, I explained what a fistula is, and you understood that it is a very complex anal disease. The treatment for this disease is varied, and many colorectal surgeons are hesitant to treat it because it is so complex. Its failure rate, meaning the rate of unsuccessful treatment, is also very high worldwide. Therefore, it is essential for both doctors and patients to have extensive knowledge about it, because if patients are not aware of its complexity, the doctor cannot treat them properly. We usually classify fistulas into two types: low-level fistula and high-level fistula. It can also be classified in another way: complex fistula and simple fistula. For patients, it's easier to understand it as a simple fistula, which heals easily, and a complex fistula, which does not heal easily. This classification of fistula as high level or low level, or complex or simple, is based on the path the fistula takes through the external sphincter, which is the outer door of our anus. That is, whether it comes from above or below, and how much of the sphincter it involves. When it involves more than 30% of the external sphincter, we call it a high-level fistula. In this case, surgery is very challenging and complex, because if the sphincter is cut during the conventional surgical procedure, fistulotomy, a serious anal problem can occur, which we call incontinence. That is, the patient loses the ability to hold stool. So in trying to cure one disease, another is created. Therefore, this is a very complex situation. Also, when the fistula is far from the anus, or its opening is very deep inside, even up to the pelvis, its treatment becomes very challenging. Furthermore, it can be a multiple fistula, meaning there can be many external openings, which also makes the treatment very complex and challenging. Therefore, all these factors must be considered when treating a fistula. A surgeon needs to determine what type of fistula it is, how complex it is, and how difficult the treatment will be, and then share this information with the patient. For example, explaining that your fistula is this complex, and these are the chances of it getting better or worse. These issues are present here. But Alhamdulillah, with the laser method I am now using, all types of complex fistulas can be treated successfully, and patients are making a full recovery. This is the amazing feature of this new method. We will discuss these matters in more detail later. Until then, stay well and stay with us. Thank you all.